Health Equity Partnership is a coalition that is dedicated to serving the 27 cities and towns of North Central Mass and promoting health equity in those cities and towns. We hold the Community Health Improvement Plan for the region. What that does is look at all of the different areas that affect a person's whole health, whether that's their access to food, their social and economic status, their connections in communities, civic engagement, mental and behavioral health, transportation access, access to health care. We take all of those pieces together and try to move them at the policy and systems level.
The Health Equity Partnership is a bridge. It is a way for disparate sectors to come together to identify how their work can be synergistic together, and it is a way to look at the way that we address the systemic issues around health in our region collectively, but also address them at their roots.
We're the ones at the hospitals, any other task force that look to say, we need your help. We're the ones that, do the groundwork and really work with everybody.
I think that the Health Equity Partnership plays a critical role in the region, being a convener of a variety of different stakeholders, as well as being a voice for people who often can't be a voice for themselves.
So there's a lot of collaboration and partnerships with the bigger organizations, but also looking out for the small guy, looking out for the smaller organizations that probably wouldn't have as much voice in the community if it wasn't for the coalition, the Health Partnership Coalition.
The people that I serve at Ginny's are often people who are at their worst day because of emergency situations that they found themselves in. And the Health Equity Partnership is a voice for the constituents that I serve and people across the region, and I think that's so important.
What makes me proud to be part of the Health Equity is the individuals that I work with. The hearts that are involved in the work that they do comes from the heart.
Everybody who's on the board or connected with the Health Equity Partnership are really caring and good people, and they want to see improvements in the community.
I love being out in the community with everyone because it's really amazing to be able to hear all of the work that everyone's doing towards our shared goals.
I am proud to be part of the Health Equity Partnership because of the strong collaborations that I have built here, the advocacy partners I have found, and the people who are willing to roll up their sleeves and get in the trenches with you to make a real difference.
So I'm a nurse, and what makes me proud to be part of the Health Equity Partnership is knowing that there's still a lot of needs and a lot of areas to grow, to share my career and my expertise, to continue to learn myself, and to help others.
The thing that brings me joy about being here tonight and with this group of amazing people is that it's so joyful to work together collaboratively to help improve the needs of our community.
I've been working with the Shenanigans for many years, and I've seen the organization develop through time and the people involved in it grow through time, and so that gives me a lot of joy and pleasure to see people developing and just looking around and see the youth participating and being outspoken is really, really nice.
What makes me glad about being part of the Equity Partnership really is just being able to bring more access and being able to learn more also and grow within the community. I feel like there's a lot of things that I could still learn, and there's a lot of people that I look up to in this organization that I know will be more than happy to mentor me and continue to grow on a personal level, but also in order to be able to help our community.
A good day in the work I do is being able to see the impact and knowing that I did truly help someone and that what I did really mattered.
The North Central Mass region is one of the most collaborative regions anywhere. That collaborative ethos is really going to drive us into spaces where we could not have accomplished any of what we're going to be doing with one organization at a time. I really think that we're moving in a direction where we have a lot of voice at the state level. A lot more attention is getting paid to North Central. There's a lot more understanding of what goes on in rural regions because of the advocacy work and our voices at those tables.
Part of what the coalition does is mini grants every year. So I know firsthand some of the projects that started because of the mini grants. For example, Project Redemption, which is an anti-stigma photography project that we started about 8 years ago, and it's still going strong. We brought a project not only in North Central but also all over Massachusetts. We brought the photos to the State House and have multiple communities being part of that. So that's a great project that's ongoing and that started right here. Another project that I think it's worth mentioning is Morgan's Message. It's a youth-led suicide prevention program that's for high school and college students. So that's another project that the coalition supported and started.
I think one of the most important projects that I've kind of collaborated with the Health Equity Partnership on is some work that the United Way is doing around food insecurity and making it easier for food pantries to do their job. That's what we do at Ginny's, is we run a small nonprofit food pantry, and finding ways to make it easier for us to get food into our organization and get it out to the clients has been a lot easier because of the work that the Health Equity Partnership is doing with the United Way.
The Health Equity has been a really big partner for us this year. The health system did our 3-year community health needs assessment, and we reached out to the Health Equity Partnership because of their connections in the community. They are connected with residents, they're connected with key stakeholders, and so they helped us to formulate focus group questions, stakeholder interviews, and was able to get that qualitative data for our community health needs assessment.
It was because of the community health assessment that we identified that the nutrition-related chronic diseases and food insecurity were inequitably high in North Central Massachusetts. And because of that, it led to a very deep assessment around our food system and identifying strategies that would really address what those issues are at their roots.
The transportation has been a huge issue in North Central Mass for as long as I can remember and have been doing public health work. And under Chelsea's leadership and the Health Equity Partnership, they have really taken on this issue, and something that I haven't seen happen. They've been able to convene stakeholders, bring in experts to help us rethink about our transportation system, and maybe for once we might have a solution to that important problem.
We are working toward a master mobility plan for the region, and we are working to stand up a transportation management association, which is a workforce-driven project. And we are also working to reboot the Regional Coordinating Council, which is transportation focused on our low-income, disability, elder populations.
I see the Health Equity Partnership over the next several years really focusing on policy, system, environmental changes, advocacy, in order to make sure that our region's health is at least as good as the rest of Massachusetts, because right now it is not as good as the rest of Massachusetts.
We are known across the state as being great collaborators, and I think it's because of Chelsea's leadership and the work that the Chenal 9 has done throughout the years that have really brought people together to try to tackle large, complex issues.
As a new board member with the Health Equity Partnership, I'm excited to see what the future holds. Like I said before, I think that the Health Equity Partnership is doing critical work in the region to be a voice for people who can't be a voice for themselves, and I'm excited to help continue that mission along.
I think we're going to do amazing things in the next few years, and I can't wait to see it.